I'm talking with interim CEO of the National Osteoporosis Foundation, Claire Gill. Thank you so much for joining us today, Claire.
Thank you for having me.
To kick us off, how long have you been working for the foundation?
I've been with the National Osteoporosis Foundation for 7 years in a variety of roles. I worked in communications and marketing at first, and then became Chief Mission Officer, and then I took over as interim CEO this past January.
And were you drawn to working with them for any particular reason?
I think I had done nonprofit earlier in my career. From half my career was in nonprofit, half was in business, and I always felt kind of compelled to the mission-oriented work. So I was really pleased to have an opportunity to start working at the Osteoporosis Foundation. I hadn't done healthcare before, so that was new to me and a little bit of a learning curve. But I have a family history of osteoporosis, which I didn't even really know about until I started at the foundation. So now it's really become a passion for me.
Well, I'm sure you know a lot more than you did 7 years ago. And this month is National Osteoporosis Month, which is why we wanted to talk with you. We are focusing on that at the Spine Health Foundation. And so we wanted to bring someone in that knew a little bit more than maybe about the average person about this condition. So I guess to kick it off, I'll just ask you, how would you describe osteoporosis and its impact on those who suffer from it to someone who's not familiar with the disease?
So osteoporosis is a disease of the bone. And what many people don't know is that our bone is living tissue. We, throughout our lives, build and lose bone in a cycle. And as we're growing up, so in our adolescence and our early 20s, we build all the bone we're going to get. You build the most dense, strong bone you're going to have that's going to keep you going throughout the rest of your life. The rest of your life, the bone remodels. You lose bone, you regain bone, etc. As we age, that recycling process, the losing bone, building bone, sort of gets off kilter a little for some people. And when that happens, that's what leads to low bone mass, which can eventually lead to osteoporosis if action isn't taken. And what we need to do then is, again, remind people that we have to pay attention to our bone throughout our entire lifetime. It's what holds up the rest of the organs. It's our skeleton. It makes so much sense that we really need strong bones to be able to live healthy and independent lives. So that's the easy way to think of it, is just, again, bones become weak and become more susceptible to fracture. And that's really what the outcomes of osteoporosis are. It's that when you fall from a standing height, so you might just trip over a carpet or trip on the sidewalk. If you fall and break a bone, then the underlying cause is probably osteoporosis, because no matter what your age, you should be able to fall and not break a bone.
Now, can it be something that anyone of any age gets?
Yeah, people get it at varying ages. It is predominantly found as we age because of, again, that remodeling process slows down a little bit. But there's definitely younger people who have osteoporosis. There's many people in their 20s and 30s who have osteoporosis. I've heard from women who have gotten osteoporosis. It's called lactation-induced osteoporosis, where when they were pregnant and breastfeeding after they had the babies, they actually got osteoporosis because of the lack of calcium in their bodies. So there are rare occasions, but it definitely happens more, once we hit menopause for women. And I think that's why many people consider osteoporosis maybe only a woman's disease, although it's not. But women lose about up to 30% of their bone in the first 5 to 7 years after menopause. So again, depending how strong your bones were from peak bone mass and how well you did managing your bone health throughout your life, then again, when estrogen levels drop off after menopause, there's a dramatic decrease in bone. So half of all women over the age of 50 will break a bone due to osteoporosis in their lifetime. It's incredible. But a quarter of all men will also break a bone due to osteoporosis in their lifetime. So again, we think more about it as for women because, again, after menopause, there's more of a dramatic decrease in bone, but it affects both populations and everyone needs to care about their bones.
Wow, I definitely didn't know that statistic about after menopause. So that's really interesting.
Yeah.
Now, something that you guys have communicated at the foundation is that it's never too late or too early to protect your bones. And I think that could be said of so many things about our health, but what are some practical tips that you might have to start doing that?
That's right. Well, again, when you're young, We need to make sure that children and adolescents are getting enough calcium, enough vitamin D, and enough weight-bearing and muscle-strengthening exercise, impact exercise, so that they build that strong, dense bone, right? And, when I grew up, we used to drink whole milk, right, on a regular basis. And, we were getting a lot of calcium. We were outside all the time. So even though my pale skin, we got a lot of vitamin D. That's not happening anymore. So we have a whole generation of children who aren't really building to their peak bone mass, yes, which is really important. But they can, right? So any moms or dads or grandmas and grandpas out there listening can encourage that their grandchildren and their children do get the necessary calcium and vitamin D and do get that impact exercise. And by impact, we mean anything that's on your feet. So walking, running, jumping jacks, jumping rope, dancing, any of those kind of things are great. Swimming and bike riding, those are fantastic cardiovascular activities, but they don't build bone. So you need to be on your feet. That's what we say weight-bearing exercise. And that's true for the rest of us as we age as well. Getting healthy habits that allow us to get enough calcium and vitamin D. And you should really get the calcium from food first. If you're having a healthy, well-balanced diet with lots of fruits and vegetables and maybe some yogurt or cheese or spinach or kale, these are the kind of things that will help maintain the calcium levels in your body so that that recycling process happens, correctly and on time. And vitamin D, it's a little harder. There aren't as many foods that have vitamin D in them, and we don't go outside anymore without sunblock, so we're missing on getting the vitamin D directly from the sun. So sometimes there is a supplement that's needed for that. But for both, you should get as much as you can from a healthy diet first, and only supplement for the shortfall in your diet. So, for example, if I am supposed to get 1,000 milligrams a day based on my age group, and I had a yogurt, which had 300 milligrams, and maybe I had cheese, which had 200 milligrams, then I've already eaten 500 milligrams. I wouldn't supplement at 1,000 milligrams again, right? I would only need a supplement for the 500 that I didn't get in my diet. So that's something that people should keep track of during the day, and then make sure that they're getting the right amount that they need.
Yeah, when it comes to vitamins, there really is too much of a good thing sometimes.
Right, exactly right. There's upper levels of safety, but with calcium, your body will secrete out the extra calcium that you don't need. So it really doesn't do you any good to get more than the recommended daily allowance. However, it's essential that you do get the recommended daily allowance, right? So that's kind of the fine line.
Well, one of the things that we care a lot about at the Spine Health Foundation is sharing empowering stories of hope, people that are dealing with their issues, but finding ways through, so that we can share those with other people who maybe are at the beginning of that journey. Do you have any stories that you could share with us about people that have worked through this that you know?
Yeah, there's tons. And actually, we have an online community that anybody can sign up for on Inspire. You can reach it on our website at nof.org. And there you'll find a lot of peer-to-peer support and really good stories from people about their journey through osteoporosis. So I think a couple of things to keep in mind is that it is a chronic disease. And that is something that's hard for people to face. And, at first they might be a little bit daunting, like, oh no, I fractured a bone and potential to continue these fractures. But as many of our patients have found out, once they were aware of the need for better bone health and aware of their deficiency, then they took the steps necessary to kind of make sure that they continue to improve their bone health. So one very personal story is my mother had osteoporosis. She broke her hip and in her 80th year, which is very common. Sadly, about 25% of people who break a hip die within the first year after that fall. So, but again, my mom is a success story in that she went to rehab, she did the work, she, got herself back up, and then she was able to return home and live independently again. So that's always one of the better stories that we'd like to hear. We have several online moderators, volunteer moderators, who help greet people on our online community and share their story. And one of them is Ray, and Ray talks about the fact that he had multiple fractures. I mean, he really was fracturing over and over again, different bones in his body, until he got diagnosed with osteoporosis. And again, he didn't realize that this was an issue. And as a man, again, he was sort of surprised that it was something that he should have been paying attention to. But he did, and he got his bone density test, and he was prescribed treatment, and he's been on that treatment for a number of years. And thankfully, all of his fractures have stopped. And he talks about that really was, becoming aware of how important his bone health was and that he did have a deficiency changed his whole perspective, because once he could start treatment, he knew that he could stop the fractures and the pain that he was suffering went away. And again, it became something of, he wanted to be passionate about telling other people about it. So now he's joined the community and he volunteers to talk with other people on the community about his journey. So again, both men and women, there's lots of success stories, and it's a matter of just getting tested, finding out where you are on the bone density levels, and then seeking treatment from a provider if that's right for you.
I was going to ask this, and this is coming from a person who doesn't know a lot about osteoporosis, but when you mentioned that a lot of people die within a year of breaking their hip, yeah. Can you talk a little more about why does that happen? Is that related to overall health and wellness, or does that actual breakage really contribute to overall death?
Basically, we found that the breaking of the hip in many patients leads to like a downward spiral. So we said 25% die within the first year. It's usually hospital readmission, pneumonia, something like that, where again, they're not getting the movement, they're not recovering the way they should. And then unfortunately, they expire within a year. About 50% of people actually move to an assisted living facility or to some care facility, acute care facility, nursing home. So again, they're not able to return home. They're not able to live that independent life. The remainder actually will have an ambulatory device. So my mom, again, returned home. She lived with my sister and her family, but she used a cane from the rest of her life, right? And so that's generally the trajectory for people with hip fractures, which was why it's so important to prevent the hip fracture. Mm-hmm. And again, many people don't know these statistics and they don't think about it. And I actually, when my mom broke the hip, I wasn't at the Osteoporosis Foundation, and my sister found that statistic online, and we thought, this can't be possible, right? This mm-hmm. Our independent mom who is so with it and together and, goes to all of our family vacations and all of our activities, she could be gone in a year, So we're really lucky that did not happen for her.
Yeah, I think that's such an interesting piece of information, because it could then make doctors and families more aware of like, okay, this is a huge risk factor. It's not necessarily the reason, but it's compacted with all those other things. I feel like that could be really helpful in seeing that number go down in the future.
The other thing people don't really realize too, just I want to point out, is even that first fracture. So if you're a woman over the age of 50, woman or man, I should say, sorry, over the age of 50, and again, you fall from a standing height and break a bone, that's the seminal event. That's your opportunity to say, oh, something's wrong here, right? Mm-hmm. Then get on a path to building better bone health, because fractures beget fractures. If left untreated, you will fracture again if you fall, or for some people, it gets as complicated as they could sneeze and fracture a bone, or they get hugged and they fracture a bone. The bone becomes so weak. So that first fracture is really the sign for anyone to say, wait a minute, why did I fracture? Or why did my mom fracture from that fall? Get to a doctor, find out what the bone density level is, and try to get some assistance.
Yeah, take action right away. When people are first coming to you at the foundation, what are some of the primary questions they have about what to do next?
The first one is, again, people wanting to take control of their lifestyle and make the changes needed to either avoid taking medication or to change the trajectory of the disease. And as we said, exercise and weight-bearing exercise and muscle strengthening exercise and the nutritionist's calcium, vitamin D are essential, and definitely something everyone should be doing, whether you have been diagnosed with osteoporosis or not. But I often tell people, if you could change it with diet and exercise alone, then I wouldn't hear from anybody who did everything right. The people who never smoked, never drank, run marathons, they get calcium and vitamin D, they do all that kind of stuff, they still have osteoporosis. So again, unfortunately, changing diet and exercise alone will not prevent the osteoporosis. But it is absolutely necessary to be able to prevent further deterioration of the bone, and necessary to even make the medications and treatments work. You have to have the correct levels of vitamin D and calcium in your body. So that's kind of the biggest question people come to. What can I do, right, to take control of this? And that's what you can do. Change your lifestyle habits. Don't be sedentary. Get the exercise that you need. Start thinking about your diet. But most importantly is talk to a healthcare professional. Find out where you are. Many patients can just be monitored for a number of years. If they just have low bone mass, then most physicians will continue to monitor you and just give you bone density tests to see, are those things that you're doing, diet, exercise, etc., keeping you stable? Or are we seeing a decline and we really need to step in and put you on treatment? And the great news about the treatment is there are many of them, and they are very, very efficient at helping to prevent fractures. So there's a lot of great success with them. And so people need to look into the different types of treatments, determine which ones are for them. Some of them are injections, some of them are oral. There are things that can fit your lifestyle. And that's the kind of conversation that people should have with their healthcare provider about really what's right for them.
Yeah, absolutely. Now, like the rest of us, you guys have been probably working from home during the past couple of months. How have things changed for you in, I guess, working with clients or patients? And how, I mean, have things changed at all? Or what's the environment been like for you as a foundation?
Well, I think things have changed for everybody. So no one's immune to this pandemic and what's been happening to us in our communities. I think what's changed for us, besides working at home, obviously, is there have been some new rules and regulations that have come out of the Centers for Medicare and Medicaid about both how physicians and patients can contact each other. So you might have heard a lot about telemedicine. It was sort of on the fringes before, now it's become mainstream, and I think it's pretty much here to stay. But there were kind of new rules and regulations for how those requirements are to be met, and how physicians and other healthcare providers, nurse practitioners, physician assistants, nurses can communicate with patients who may not be able to get into their physician's office, or are among the vulnerable populations that should not be going near a physician's office. Mm-hmm. So again, educating healthcare professionals and patients about what those new rules and regulations are and how best to do it. And then there are some medications that fall under Medicare Part B, where I would go to my physician's office to actually get the drug injected. If that's not possible now due to the office being closed or my vulnerability, again, CMS has tried to relax some of the rules and regulations about how to get patients that treatment, whether it's through a visiting nurse service. Some places have even done drive-through, like you've seen the drive-through testing. They've actually done drive-through injections where the patient can pull up, get their medication, and move on. All of that, as you can imagine, is incredibly complicated. It's new to everyone. So we've been doing webinars, we've been doing surveys, we've been reaching out and sending comment letters to CMS to say, hi, this is terrific that you're doing this, but here's how it's not working, or what we need to improve, and here's where we think it's working. And so I think that will continue throughout this crisis, is just trying to help alleviate the fear patients have about how to manage the disease during this crisis, and how to keep everyone as safe as possible during the pandemic.
Yeah, you know, it almost seems like we're all going to come out of this in the end becoming more efficient and more educated about everything that we're doing, because we've been forced to take a closer look at the way things are done. So I guess that's a silver lining in all of this in some way.
Yeah, if we can really focus on that and try to figure out again, what did we learn during this pandemic about patient care, and even again about some of the restrictions on clinicians on how they treat and where they treat. I think that could be a silver lining and would hopefully help us to improve the patient journey and the patient care throughout, because that's really what the main goal is, right? We want to make sure that everyone lives the best quality life they can, and they manage whatever unfortunate, disease risk, whether it's heart disease, cancer, osteoporosis, whatever it is, that we can manage that and live happy, productive, healthful lives in treatment.
Yeah, absolutely. Well, Claire, thank you so much for joining us for this special Facebook Live for National Osteoporosis Month. So we appreciate it, and we appreciate all that you guys are doing.
Thank you so much. And like I said, we're doing some great things on our website at nof.org. Definitely check it out. We have a 10,000 steps a day challenge going on in May. So again, while we're home and supposed to be keeping active, check that out and participate.
Absolutely. All right. Thank you so much.
Thanks. Have a great day.